Hey everyone, this is Ankit. We are going to study tonight about muscles of lower extremity. Especially, we will focus on muscles of hip and knee muscles and the ligaments at the hip joint. Okay. All right. Let me share the screen. Okay. All right. So you guys can see on the screen. Let me go back. This is your pelvis. Okay. And if you guys remember from yesterday's class, what we studied, this is your anterior superior iliac spine, and this is your anterior inferior iliac spine. Okay. All right. And yeah, that's how it is. And then let me clear that. Now your pelvis is like this. This is the anterior view, and you guys can see here, this is your patella over here, and that's a femur, and that's ASIS. Okay, now let me zoom this, and we are going to study about ligaments at the hip joint. Okay. 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 So the first one we'll talk about is the anterior ligament, which is iliofemoral. Oops, sorry. Iliofemoral. Let me remove some of the others. So this ligament is iliofemoral ligament. Now, iliofemoral has actually two bands. Let me zoom it. And I'm showing you a view from the top. And as the name suggests, it originates from ilium and goes and inserts on your greater trochanter. Okay, if you guys can see there, that's anterior part of the capsule, which is almost at greater trochanter, lower part of greater trochanter. Okay. Now there is another ligament, another band of iliofemoral ligament. You guys can see this, how it starts here, and it is actually attaching on the top. So one ligament is attaching anteriorly, and one band is going attaching on the top of greater trochanter. So let's understand the function. How do they work? So if iliofemoral, this anterior ligament, what will be the function? Prevent what? Extension and external rotation. Okay, they will prevent extension and external rotation. Anything present anteriorly should prevent that. Okay, same thing for your pubofemoral ligament, that also does the same thing. Now, one more important thing is, since your superior fibers, let me delete this, superior fibers of iliofemoral ligament, this one is present here superiorly. Okay, this will prevent actually adduction. Okay, this ligament will prevent adduction. So when you do adduction, I want you guys to visualize this. You guys can see this. That ligament is coming from the top and attaching here. So when I do adduction, my knee is going in, but this end is actually going out. Okay, so you'll be stretching the superior ligament when you do adduction. Okay, that's a function of this ligament. All right. Let me remove this muscle. Okay. Now the next one is, let me remove this ligament also. Next one is, you guys can see second ligament, which is going from here and attaching on the femur. And actually it attaches on the lower part of your trochanter. So this is pubofemoral ligament. Pubis, which is over there. So this is the pubis. So that's part of your pelvis, pubis, and that's where this ligament originates, and it inserts on greater trochanter anterior inferior portion. Okay, trochanter anterior inferior portion. Now, what do you guys think? What will be the function of this ligament? Yeah, you can say external rotation, extension, and actually it also does restrict abduction. So when you have abduction movement at femur, this ligament, if you can see, it's going away. It's getting stretched, my index finger. So that ligament gets stretched if I take the femur out. Okay, so remember that. All right, I hope you guys are clear with pubofemoral, iliofemoral. All right, the last one is, let's remove this one too. Now the last one is your ischiofemoral. That again starts from the pubis, ischium posteriorly, and inserts on your greater trochanter area, more anteriorly. Actually, it goes from back, comes from the back, and it goes anteriorly and inserts. So this ligament actually prevents internal rotation. Okay, when you do internal rotation, you'll be stretching this ligament. Okay, so that's one unique function of this ligament. So I think we are clear with the ligaments. Let me remove this one also. And what do you guys think? What is this thing? This is the capsule, which is present underneath those ligaments. So always remember, all the ligaments are actually reinforcing or making your capsule stronger. So they are sitting on top of the ligaments. Okay, those ligaments are sitting on top of capsule. Okay, that's gone. Now you guys can see that that's your femoral head, neck, and head. When you remove the cartilage, you guys can see the head, and you guys can see how your acetabulum is. Okay, this is acetabulum, which is concave. Femoral head is convex. Okay, there's one more ligament present here, ligamentum teres, which attaches on the femoral head. From acetabulum to femoral head, that is ligamentum teres. Okay, so I think we are done with the ligaments. Let's remove them, and then we'll go to muscles. Okay. All right, so let me cut this off. Okay, so now we are going to talk about the muscles. Okay, and okay, so let's zoom in. Let's remove these arteries and veins. So I'll start with hip flexors, and let's see how much we know about that. Okay. Let me zoom in. So you guys can see on the screen here, this is your ASIS, if you remember, anterior superior iliac spine. So let me take all those muscles off. Okay. All right. Now, what do you guys think? What's the origin of iliacus? It originates from the inner surface of your pelvis. Okay. From the, give me 1 minute, let me get the pelvis. From the inner surface of your pelvis, inner surface, and then it goes. So it's coming from there. And I want you guys to look at the screen. It's starting from the inner surface of pelvis, and it goes and attaches. What do you guys think? What's the insertion of iliacus and psoas major, they actually combine before they attach on femur. Okay, and I want you guys to recall what will be the insertion point for them. Greater trochanter or somewhere else? Let's check that. All right, so I'm going to zoom it so you guys can see. So this is your muscle, iliacus, and that's the neck of the femur, anterior part of the femur, anterior part of the neck. And this muscle is actually, what do you guys think? Where is it going? It's going back, and it's actually inserting on lesser tubercle. Okay, so I'm gonna again look at that. It's inserting on lesser tubercle, not on greater tubercle. And let me show you that lesser tubercle is present more posteriorly. That's the ASIS. That's the trochanter, greater trochanter, lesser trochanter. Let me turn it around. Let me remove some of these muscles. Okay. So that's your iliacus. It inserts on the posterior part of the lesser tubercle. Okay. I'm gonna again zoom out. Look at that. Originating from iliacus, goes down and blends with psoas major, and both of them insert on the posterior part of lesser tubercle. So what do you guys think if this muscle contracts from here, insertion goes towards origin, what movement will happen? What do you guys think? Will it be internal rotation or external rotation? It will actually rotate externally. It will cause your femur to rotate externally if your origin of iliacus goes, or insertion of iliacus goes towards origin. Okay, and that's where your psoas major and iliacus, both of them are inserting. Okay, so please do remember that, very important for exam. They are internal rotators. And what other function? If the insertion is going towards origin, you'll have hip flexion, okay, and external rotation. If origin is going towards insertion, if this origin is going towards insertion, pelvis will tilt anteriorly. Okay, remember that. All right, so I hope we are doing good there. Okay, now one more thing I want you guys to know. I'm going to teach psoas major more clearly in a better image, but let's right now understand this. That's your psoas major, and psoas major comes from your lumbar spine. It attaches on the lumbar vertebrae, lumbar spinous transverse process, and comes down. So one function of this muscle is side flexion of your trunk. If unilateral muscle, if one side muscle work, it actually helps you in side flexion. Second function is if both of them are working, both the psoas major muscles are working, it will help you in trunk flexion. Okay, so please do remember. All right, and psoas major will also do hip flexion and external rotation. Okay, all right, let's clear that. Okay, so let's study these lateral muscles. So what do you guys think? What muscle is this? G medius, and it is a primary abductor. It will help you. So if the insertion goes towards origin, you'll have abduction. Okay, and if origin goes towards insertion, so when this muscle is tight and when you're standing on one leg, this muscle can pull the origin towards insertion. So it can cause actually lateral pelvic tilt. Remember this, lateral pelvic tilt is done by this muscle. So this is a primary abductor and it can cause lateral pelvic tilt. Okay. Apart apart from that, any other function? Now GMED has two group of fibers, which is quite interesting. So GMED actually also helps in internal rotation after 90 degrees. So after 90 degrees, this insertion point is actually anterior to the femoral head, and it can help you in internal rotation beyond 90 degrees. And if you're standing straight, it will help you in external rotation. So it depends how much knee flexion is happening. Okay, let's get rid of that. And don't forget, GMAD is the one that is responsible for Trendelenburg bone. Now, what do you guys think? What is the second muscle? This one underneath your GMAD, which is G minimus, which is also an abductor. Okay, but this muscle is present more anteriorly. So this muscle actually is an internal rotator, anterior to your head, femoral head. So not the head, trochanter. So it helps you in internal rotation, and it is an abductor. And this muscle is also, if you see, this is present laterally. So it also, if this muscle gets tight, the pelvis will tilt towards your greater trochanter, which is called lateral pelvic tilt. So in the exam, they might modify that lateral tilting of pelvis. Okay. All right. So we're clear with GMED and GMIN. Let's remove them. Those two muscles are gone. We're not studying the veins. That's your piriformis. Look at piriformis. How it's coming from your sacral part, sacrum, goes underneath, okay, underneath your PSIS, posterior inferior, PIIS, posterior inferior iliac spine, and attaches on the trochanter, top of the trochanter. It is an external rotator. It is a strong external rotator. Okay. All right, so we are clear with that. Let's go to some femur muscles. Let's go back. Okay. So we are going to study next is your, so we are done with that. So what do you guys think? We have, this is ASIS and this is AIIS. So you need to tell me the name of these muscle that originates from the lateral part of the ASIS. So let me show you what is lateral. Actually, it doesn't insert anterior. This muscle is your sartorius. It is more of lateral to your iliac, anterior iliac crest or ASIS. Okay, and this muscle is present just next to tensor fasciolata. I'll explain you this, which is also an abductor. Let me remove this one. This is IT band, but this muscle underneath IT band is tensor fasciolata, which is also an abductor. Okay, and that fasciolata is present next to your G-min. So you guys must know this. Gluteus medius, underneath it you have gluteus minimus, and next to that you have tensor fasciolata, which is also an abductor. All right, so let's study this one. Sartorius. Let me remove this. All right, so you guys can see this muscle. Starts from ASIS, anterior superior iliac spine, and the next one starting from AIIS is your rectus femoris. Don't forget that. Okay, these two muscles, very important. And when they get tight, they will cause the pelvis to tilt anterior. Okay. Now, where do they insert? I'm going to show you. Let's go down in your leg. So this dark one, yellow, actually it's crossing your knee joint. I'll show you. And it's present medially. So if you see this muscle, how it's coming from the top, from the lateral part, ASIS, goes down, and then at the lower part of femur, it starts to go inside, okay, medial to your femur, and then actually it crosses your knee joint and inserts on where? It inserts on tibia. So let me open this joint up a little bit so you can see. Okay, so that's your tibia. This is your tibial tubercle. This point is your tibial tubercle. That's the tibial condyles, and just medial side of the tibial tubercle. Medial side of tibial tubercle is your okay. That's on my left side. So my left ASIS will be here, and that muscle will come down and insert on the medial side to the tibial tubercle, medial to the tibial tubercle, which you can see in the image. Okay, let me make it more clear. Oops, sorry. So let's go on the lateral side. And if you guys see at that one point, there are so many muscles coming. So let's do origin insertion of this muscle quickly. This muscle originates from ASIS, inserts on tibial tubercle medially. What do you guys think? What will be the function of this muscle? So first of all, this muscle will, this is how the anterior alignment is. Your patella should be anterior. So this muscle is actually hip flexor and abductor of your hip. So it also helps in abduction. So when you do abduction, this muscle contracts because the way this muscle is originating, it helps you in abduction. Okay, so again, think it goes from here and then it goes in. So when you do abduction, this muscle is still shortened because it's present on the lateral side of the joint, of the hip joint. Okay, so remember that very important muscle of the anterior compartment, sartorius. Now we are going to study some other muscles for inserting at the same location. Let's study them. All right, so this is the point medial to the tubercle. Let me get rid of sartorius. What muscle do we have there? And there's one more muscle just underneath this other muscle. And then there is a bursa present there. So this is your gracilis, which comes from where? Pubis. I'll show you where is pubis located. And this one is your semitendinous. Semitendinous. So gracilis, and on top of it, it was sartorius, gracilis, and semitendinous. And underneath these three tendons, we have a bursa called pes enserine bursa. That bursa gets inflamed sometimes. I'll explain you when does it get inflamed, but let's understand one mechanics. So that bursa gets compressed under these muscles sometime. Now these three muscles, sartorius, your gracilis, so this is sartorius, gracilis, and your semitendinous. All three of them are inserting on the medial side of tibia. So what do you guys think? What function can they do? Will they do on tibia? They will rotate your tibia internally. Okay. And if they are weak, your tibia will rotate externally. All right. So that is a function. Your tibia is supposed to stay straight. And if these muscles are tight, tibia can be rotated internally. All right. And if tibia is rotated internally, what will be pointed in? Tibia is weak. These muscles are weak. Tibia will be rotated externally, and what will be pointed outward. Okay, remember that. So, what do you guys think when tibia rotates internally? That's when they compress the bursa, or when tibia rotates externally. So you have to think. So they are actually here. So when my tibia rotates, let me draw it on the screen. Externally, they get stretched, and the bursa present underneath gets compressed. Okay, so these muscles are getting stretched, and this bursa gets compressed under them. Okay, so that's called pes enserine bursitis. Remember that. Okay, all right. Pes enserine bursitis happens because if these muscles go weak. Okay. And when we say sartorius is an internal rotator of tibia, so we are saying internal rotator of tibia, not the hip joint. Sartorius is an external rotator of your hip joint. The way that muscle is going from out to in, it causes external rotation. It causes actually this kind of posture like genu varum. That's your hip joint. That's your knee. So it actually causes this kind of posture. So this will be considered flexion of hip, abduction of hip, and external rotation at hip is happening. And try to stand in a genu varum position, varum. And you'll see that this is what happens at your hip joint, flexion, abduction, external rotation. But this muscle actually does internal rotation at tibia. Remember that. Okay. Now we are going to study some other muscles. Let's do it quickly. We'll study about rectus femoris. Right. So let's clear some of the other muscles. All right. So now we are going to study about rectus femoris. Okay. Let me share the screen again. Okay. All right, on the screen, you guys can see now that's your pelvis, ASIS. Okay, let's clear that. And we have from AIIS, your rectus femoris is originating from there. Okay, let me rotate it a little bit so you get an idea. It goes from there, and where does it insert? It inserts on your tibial tubercle. Actually, it blends with this patellar tendon and goes down and insert on the tibial tubercle along with the patellar tendon. Okay. Function of this muscle is if the origin goes towards insertion, it will cause anterior pelvic tilt, APT. If insertion goes towards origin, it is a very strong knee extensor. Okay. It is a very strong knee extensor. So what do you guys think? This is lateralis present just next to them, next to this rectus femoris. Center is rectus femoris. Laterally lateralis, medially medialis. Okay. What do you guys think? Where does medialis and lateralis insert? Is it like on patella? Let me clear this up. So joints. So lateralis inserts on the medial side of patella. Sorry, lateralis on the lateral side of patella. Medialis on the medial side of patella. And then in between there is intermedius, which is not visible, which is present underneath your rectus femoris. That intermedius, medialis, and lateralis, all three of them blend, and they actually combine, attack, or blend with your rectus femoris. And rectus femoris is the only muscle that goes down or crosses the knee joint or crosses this patella. Okay, only rectus femoris goes down and inserts there and causes knee extension. Okay. All right. Next thing. So tell me, where do they originate? Rectus femoris, lateralis, and medialis. I want you guys to think a little bit. What is the origin of that muscle? All right. Oops. Hold on. Oh, we are in the back of the knee. Oh, I twisted. Okay. Now you guys can see. Tell me, where are they originating? So let me zoom it. Let me comment it. That's the ASIS. and that's your patella. So this is the anterior view. Okay, let me zoom again. This was your rectus femoris. Let's remove that. Okay, so this is your muscle, lateralis, inserting at patella, and it actually inserts on the trochanter. Let me zoom in. So that's the trochanter, greater trochanter, and they originate from there, medius, medialis. So lateralis, intermedius, and medialis. In that sequence, on greater trochanter. Okay, in that sequence, on greater trochanter, but they go more anterior. They are present more anteriorly. They don't do any abduction. They are present more anteriorly. And now you guys know where they insert. So just think, what is the function of this muscle? Is this muscle of any use other than knee extension? And even for knee extension, they are blending with your rectus femoris. So the only major function they do is knee extension with rectus femoris and moving your patella in and out. You have such a big muscle, not very effective. So if somebody asks you what will happen if insertion goes towards origin, probably nothing. I mean, they cannot pull the head or trochanter. If trochanter is being pulled anteriorly, so they may help you a little bit with rotational part. But again, may get strict, so avoid that part. Let's not get into that. Okay. So let's get rid of these three muscles. Let's see what else we have. Okay. So we're done with rectus femoris, done with vastus medialis, lateralis. Remember, they are attaching on the patella, and it's very important how they're controlling the patella. One from here, one from here. Okay. Then we have some other muscles. Let's study them. Adductors, as I told you guys, how they are originating. Let's clear some other muscles from this area. Adductors is easy. They are like adducting. Let's study the other muscles, some pectineus and gracilis, which are more complicated. Right. Let me zoom in. So what do you guys think? What muscle is this? This big muscle coming and inserting on the femur. But that's posteriorly, that's hams actually. No, adductor, sorry. This one is hams. It goes down, same membranes. Okay. I'm going to teach you about gracilis. Just for your information, adductors, one brevis is at there, and then you have, magnus brevis, and then we have longus. One more. I'll show you in the image gradually. Source major. Let's get rid of them. I think I deleted. Let's go back. So I'm going to zoom again, and we'll find gracilis. Okay. So gracilis actually inserts there. I told you, pes. What will be the origin? Let's find out the origin. Deleting some lateral muscles. Let's go in. That's your precise. Where is that? That is actually lower part of your pubis. Yes. So that's your pubis. It's originating from the inferior part of the pubis and inserts down. So this muscle helps in adduction component. It's adductor of your hip, but at the same time, this muscle can cause internal rotation of your hip. So remember that part. Apart from that, let's study. I think we have pectineus. Let's see if we can find pectineus here. That's pectineus. Okay. So what do you guys think? What's the function of pectineus? It is an adductor. And where does it originate? From the pubis and inserts on the inner part of your, that's your greater trochanter, inner part of your femur. More posteriorly. Okay. So that muscle is coming from the pubis and goes from pubis. Pubis is more anteriorly and it goes down and posteriorly to your femur. So try to find out the function. Origin to insertion, what can happen? Sorry, insertion to origin will be adduction. Origin to insertion, what will happen? If this one gets pulled down because of that muscle. But all the adductors, when they are weak, what kind of tilt we may see if the adductors are weak? They get stretched, so they cause lateral tilt. That's one way of looking at it. If they are weak. Okay. Let's go to some other major muscles. Let's do some hamstrings. So we're done with rectus femurs and all. Let's do hamstrings. Not sure if we have done G-max. This is your G-max, big muscle. Let's turn around. Partially from the sacrum and partially from your, let me clear that, from your pelvis. See that? Posterior part of the pelvic crest and some sacrum, and goes and inserts where? Let me show you. Inserts on greater trochanter. That's one fiber. Inserts on greater trochanter. And it has some other group of fibers, second group of fibers, which goes down and it blends with this band. And there's another group of muscle comes down and blends with this band, IT band. So G max coming from posteriorly and TFL coming from anterior laterally. They go down, they blend, and they form this tendon. So this tendon is non-contractile, but these muscles can contractile. Okay. All right. So remember that. That's one unique function. Let's clear that again. So if you can see, this muscle doesn't attach anywhere. Here, this is your tensor facial artery. It doesn't attach anywhere. It actually blends and attaches with your IT band. Okay, and function of this muscle is flexion, abduction, external rotation. Okay, let's remove this G max. This muscle is gone. We did piriformis, and let's study hamstrings. All right, so we have so many muscles coming from downside. Ischium. Okay, and that's where ischial tuberosity is. That's pubis. That's where ischial tuberosity is when you're sitting. So when you're sitting and you feel that bone hitting the chair on hard surface, that's your ischial tuberosity. Okay, so let's figure out what muscles are there. You have, I want you to see something. Hold on. All right, so they're coming from ischium, all three of them: semimembranous, semitendinous, and biceps femoris. Those are the three fibers. And actually, biceps goes laterally and inserts where? Let me remove this gastroc so we can study it. So biceps from here goes and inserts on your fibula, okay, head of the fibula. And does it have any insertion on tibia too? Let's clear out. Okay, let me go back. How did I remove that muscle? Yeah. Okay. Let's zoom in. Biceps femoris. And other two, semitendinous, semimembranous, are medial. Biceps femoris is laterally. So biceps femoris can actually cause lateral rotation of tibia. Okay, that muscle can cause lateral rotation of tibia. Let's clear out some of the other muscles there. This is your biceps femoris attaching on fibula. Okay, and that will cause lateral rotation of your lower leg. Lateral rotation of your lower leg. Okay, you guys can see that now. That's your fibula, top of the fibula. Okay, and they can cause lateral rotation of your lower leg. Okay, all right. Now coming on the medial side, you have semitendinous, which actually is a pes muscle. Okay, and then your semimembranous present posterior. Where does it insert? On the tibia posterior. If I remove that, you can see that on the tibia posterior. And what do you guys think? What will be the name of this bursa? So there's a bursa present between semimembranous muscle and the bone. That bursa is supposed to prevent bursitis, rubbing of that muscle. Okay. So what do you guys think? What will be the function of semimembranous? Hip extension, knee flexion, and medial rotation of tibia. What will be the function of biceps femoris? Hip extension, knee flexion, and lateral rotation of lower leg. Okay. And what will be the function of your pes and semitendinous? Hip extension, knee flexion, and medial rotation of tibia. Okay. So remember that. So those are the three hamstring muscles, very important. And that is, if the insertion is going towards origin, you will see those functions. What if origin goes towards insertion? So that's the origin. When that origin is being pulled down, okay, it will cause pelvis to tilt posteriorly. And they are attaching on the posterior part of the ischium. So when they are down, or when they're tight, they'll cause the pelvis to tilt posteriorly. Okay, remember that function. Okay, so I think we're done with those major muscles. Let's see if there's anything else. Okay, let's do some more interesting muscles there in the lower leg. So remove this hamstring, gone, and this is your tendinous gone. That's your adductors. IT band is present laterally. Look at the insertion of IT band. Now your Gmax and TFL, they originate and they blend with IT band, and that IT band is going, where is it inserting? on tibia. Show you. Clear that out. So that's your IT band. And underneath over here, there's a bursa, iliotibial bursa, to prevent the rubbing, which does happen in friction syndrome. The IT band starts rubbing femoral lateral condyle. This is the lateral condyle of femur, which gets rubbed by this IT band laterally at 30-degree knee flexion. They start rubbing each other. Okay, let's get rid of that. And it's actually inserting on your tibial lateral condyle. And this IT band, actually they have not shown here, but it has one insertion here on the patella also. So if this muscle gets tight, it will pull the patella laterally. Okay, so when your patella is going laterally, it's called patellofemoral pain syndrome, which is also lateral tracking of patella. And if patella goes medially, which is also medial tracking of patella done by medialis. Okay, right. That's it. Okay. Anything else? Let me see. Hold on. Okay, let's remove these muscles. And I'll talk about one unique muscle, interesting muscle. Okay. All right, so you guys can see one thing here. If I remove this IT band, okay, there are some ligaments, your lateral collateral ligament present there. You can see the names. Lateral collateral from femoral condyle to tibial condyle. Okay, let's move some lower leg muscles also. But I want you guys to see one thing. Let's get rid of all these ligaments. There is a muscle originating from down here, from tibia, medial side, and goes up. So medial side of tibia goes up and inserts on your lateral condyle. And that muscle is popliteus. So what do you guys think? What will be the function of that muscle that goes from femur to tibia? First function is it will shorten in knee flexion, so knee flexion. And this muscle can cause medial rotation of tibia. Medial rotation of tibia. So when this goes here or here, when this goes here up towards insertion, your tibia will rotate medial. Okay, so that's one important muscle. Don't forget that. Okay, I'll quickly show you about those ligaments, ACL, PCL, how they are. All right, so that's your knee joint. You guys can see. Let's get close to the knee joint. That's a posterior view. So posterior view is, I'm gonna rotate the knee joint, okay? Your patella is present anteriorly, patella present anteriorly. And underneath the patella, you can see this cartilage. This cartilage is called chondromalacia, which may rub too much and it may worn out, and it will lead to chondromalacia patella. So let's remove that. Articular cartilage of patella, which gets worn out. And what do you guys think? What's underneath? It starts rubbing the condyle and you'll have chondromalacia. Let's go to the ligament. That's your posterior cruciate ligament. Oh, sorry. Posterior cruciate ligament. Let's get rid of this one, which is from tibia, okay, and it goes up and inserts on the femur groove medially, from lateral part of tibia to femur groove medially. That this muscle, this ligament gets irritated if I push your tibia. Hold on. If I push your tibia posteriorly, you can stretch that ligament, okay? And if I push your tibia anteriorly, which ligament will get stretched? That is your ACL. Okay, let's rotate it. That's your PCL ligament gets stretched. Okay, now let me show you ACL. What ligament is this coming and inserting there? Let's get rid of this. So it goes from the anterior part of the medial tibial groove, and it goes backwards. Where does it go? Oops. Look at that. Anterior part of the medial condyle, okay, and inserts on the lateral groove of lateral condyle of femur, and through that groove it goes there. Okay, I'm gonna shine it. You guys can see how it is going, and it goes back and inserts on the posterior part of the medial femoral condyle. What is the function of this ligament? To restrict anterior translation. Okay. Okay. Now let's get rid of, and then between your femur condyles are like this, and then your tibia, you have something called meniscus there. What's the function of meniscus? It's like a cushion for the knee joint, which wears out very easily. Let me show you how that is. Yeah, and they are, look at the shape. This one is C-shaped, and this one is round. Okay. And then your bone. So please do remember meniscus, and you can see the ligaments. This is your medial collateral ligament, and that should be a lateral fibular ligament. So please do remember those ligaments, quite important. I think that's it for today, and probably I'll make some more interesting videos on this, and we'll cover it. So these are the major muscles we covered: rectus femoris, sartorius, vastus medialis, lateralis. We covered tensor fascial artery, G-max, how G-max blends with IT bend, and then we covered G minimus, and we covered popliteus. So I think we did a lot. Okay, so let's end this here, and let me know, guys, if you guys understand this or I can do more. Okay, all right, guys, you have a great